Okay, so I have a few things that I wanted to address via a PowerPoint presentation, but most of this presentation will be done via the Intergy demo system. So again, today we're talking about Intergy patient registration. What we're going to cover on today's training is quick registration of your patient, patient search. We're going to go over full patient registration, understanding the guarantor information, assigning insurance policies, and setting the coverage, expired insurance policies, understanding some of the UDS and patient-centered medical home-specific fields, sliding fee schedules and special population, assigning care teams, consents and advance directives, emergency contact information, adding patients and account notes, extended information fields for the PCMH page. We'll go over the patient information window. After we've done the full registration, we'll just kind of do a quick review of the patient information window. We'll go over editing an existing patient information, talk a little bit about letters and labels that you can attach to the patient information window, deactivating a patient, exempting a patient from reporting, and the quick registration report that you can run from Intergy. So before you can do any of this, you need to make sure that your security gives you the right to access patient information, access registration. So if your security does not currently today give you access to patient registration, the consents, patient information, the privacy authorizations, then you will not be able to do all of the functions that you need to do that we will cover during this training. So I think a lot of people that are on this training today are either front desk staff or front desk managers that are overseeing that staff. So I just wanted to go quickly through the user access to ensure that anybody that is on this call that is MIS, they know where to go in order to set these securities up. So under users and securities, again, since we're talking about patient registration today, we absolutely need to make sure in the security, if you go by base system, by subsystem, I'm sorry, and you go to patient and patient registration. There's also some required fields that you can set in the system. So if your front desk staff does quick registration or your call center does quick registration of patients when they're talking to them on the phone, there's different fields that you can turn on and turn off depending if it is for a quick register or a full registration of a patient. Of course, when we're quick registering, we just need the minimum information, the patient's name, their date of birth, their phone number, so that we could contact them if we needed to cancel and or reschedule their appointment. So this information is under practice configuration. Of course, you have to have security access to get into practice configuration. That's usually your MIS team. Once you're in practice configuration, if you come to patient registration fields, you are going to see everything that is either turned on or turned off. So it could be a required. So during patient registration, the date of birth is required. During quick registration, the date of birth is required. Now, this screen is quite lengthy. I only took a quick snapshot of the top part of the screen. So after this training, maybe your MIS department could go in there and take a quick look to see what we have as far as our quick registration required fields and our registration required fields. We know a lot has to do with UDS as far as race, ethnicity. So we want to make sure that those types of things are turned on and are required so that the staff cannot go by it and register the patient without that information. So there's additional information if you go into patient configuration, practice configuration, and go into privacy. Under that privacy part is the patient's Social Security. So do I want to show the entire patient's Social Security? Do I only want to show the last 4 of the patient's Social Security? So there's different things that you can change in here on how the actual patient displays, patient information displays. When a patient is registered, whether it be quick registered or fully registered, do we want to default that the consent is signed? Do we also want to set an expiration on our consents? So should our consents expire every 12 months? That is a practice decision, whether the consents expire or not. And again, under practice configuration, you can find that information. We also have here, if we do have it that the consent expires, do you want me to pop up an alert that the consent expired? So a lot of things that you can do to have the system already prompt with information and or require information during a patient registration. So what I'll do now is I'll go ahead and I'll jump into our Intergy system. So the first thing I wanted to go over is the toolbar. If you want to go up to the top toolbar and go to patient registration or information, you can do that. But there's also an icon that you can just quickly click on that it'll take you right into patient registration. If your users do not have that toolbar, that icon on their toolbar, you can go to Options, User Toolbar, and if I scroll on the left-hand side, I'll go ahead and I'll remove this since I had it. If I scroll down, and I find my patient registration, I select it, and then it puts the icon here on my toolbar. Now, if I don't want it all the way down there, I can simply click on it and move my arrow to move it up. I like to have all my patient stuff together, so now my patient registration is here. When you change these toolbars, it is not for the practice. It is per user when they go in and they change these toolbars. So the user can, again, go to Options and change their toolbar and add and remove anything they're not using. So I'm going to go ahead and click on my patient registration. So on the top, I have my quick register, which again, depending on the fields that I selected to be required, that is the minimum information that has to be filled out before I can save my quick registration. Now, once you quick register a patient, when they do come in for their appointment, that's when you'll obtain the rest of the information and finish the registration. We also have this other button, Use Existing Account. Now, some of our centers actually have the mom and all of the children under one account. Instead of having 6 different accounts that I have to look at, I can go to the mom's account and I can look at all the kids' accounts underneath her account. So we'll do the quick registration first, and then we'll go back through and we'll do a registration using another account. So if I click my registration, now if this patient was already a patient in the system, then what would happen, I'm going to just change the name here real quick, is it would already know, it would look at either first name or last name and let you know that this patient is already assigned in your practice. I can go ahead and use that patient or say, okay, no, I don't need to register this patient again because they're already registered as a patient in my practice. So I'm actually going to go back. Now, as you see, when I put my phone number in, I didn't have to put the area code in because I have a default area code set in my practice configuration so that when I just type the 7 digits, it automatically puts my default area code in place. I'm going to go ahead and I'm going to try to register it. Address is required. Now, if you notice the grayed out fields, so security is grayed out, employees grayed out, my chart, guarantor, assigned provider, referring provider, all of this information is grayed out because I don't have it set as required for a quick registration. I have my preferred phone, so if the patient does have a home phone, or they have a mobile phone and a work phone, I can say, which one do I want to be preferred? So which one do they want me to call first? And then, of course, my method, either voice, email, text, or don't contact them at all. I'm going to say voice. And their primary care provider and their care coordinator. And as you see, now I can, the zip code's required. So let me see if I can find one. I live in Florida and don't know what the zip codes are in Miami. This is the reason when you look at your required fields is make sure it is the information that you really want to have captured when you do a quick registration. This particular case, I had to fill in all of this information before I can go ahead and even register this patient. So now I get a pop-up. Alice is registered. Do I want to register another new patient? No. So now if I'm working in the call center or I'm working at the front desk, I can now go and make an appointment for Alice testing. Now, quick registered patients, you can make an appointment. You can actually check them in. But the problem is, once that patient gets into the back, if you do not have all of the information and completely register that patient, then the clinical staff cannot drop any charges if the pharmacy's not there, if the insurance is not there. So you want to make sure that when you are quick registering patients, that once they come in, that you're going and you're completely registering that patient. I will guarantee that 99.9% of our centers are doing that. So you saw how difficult it was when I had all of those fields open. That would mean my front desk or my call center person has to ask every single one of those fields in order for them to quick register a patient. So make sure you go back in, take a look at what you have, and maybe slim it down just a little bit so that they're not on the phone as long to be able to quick register these patients. So the next one in our registration, I can use an existing account. So I'll go ahead and I'll use Alice's account. I can go ahead and look at the details of that account. I can see what the account number is, that Alice is currently in collections, but her account is active. I can look at any alerts or any notes on that account. So I'm going to go ahead and I'm going to select Alice. So as you see, when I use an existing account, it's going to put Alice's account number up here. And because I'm using an existing account, I'm going to go ahead and fill in all of the information. It already has Alice's last name. But maybe this is a foster child that I'm taking care of, or this child has a different name, last name. I can actually change the last name here or keep it. You'll also notice when I use an existing account that some of that information from Alice's account already came over. So I already have the address, the zip code, city, state, zip. I have the home phone. The consent was signed on Alice's, which is coming over, but I could change that at this point. The prescription consent was also signed. Again, I could flip that to no until the patient actually comes in. And again, these were parameters as well that you can have default to yes, or you can default them to no when you're registering a patient. Mine are actually defaulted to yes. And some of these, the new sexual orientation fields for UDS, sometimes that's not information that is asked at the front desk. Commonly, it is put on a new registration form so that they could fill it out, or it is done in the back by the clinical staff. So these fields can actually not be required, or when I'm going through the sexual orientation, at this point I can say unknown and update it at another time. My date of birth, race and ethnicity, which is another UDS measurement. My employment status, and the employer. Sometimes people just skip this field altogether and they just put that the patient is employed. But I can actually put in here, I work at Walmart. Now, if the company that I work at was not available, I could always select new. I can put in my company. I can put in the address, the zip code, the city, state, and zip, and any contact information. Maybe who's their boss. Go ahead and save it. And then the employee ID. The other reason, and I don't know how many of our centers actually take workman's comp cases, but that's another important reason to have the employee status, the employer, and the employee ID is often used for a workman's comp case. So when they get a workman's comp case, that employee has an ID attached to that workman's comp case. So that's quite often what they use this field for. Again, email is very important. If you are using the practice portal, that is the communication that goes back to the patient, whether it's to generate a PIN letter or so that the provider actually knows that this patient is using the portal so that they can send information over to that patient's portal. Oop, I put too many numbers. And I put my assigned provider. Who am I actually assigned to? Very important, especially when it comes to certain types of insurances, that they may be assigned to the practice, but that insurance may also say that they're only assigned to Dr. Ford. The referring doctor. How was this patient actually referred to you? And then the primary care provider. Now, quite often, the primary care provider and the assigned provider could be the same person. But the assigned provider could be Dr. Ford, but they actually see Joel. They could, this primary care provider also could be, let me show you something real quick. If you notice, when you go to select the primary care provider, it's actually pulling from your referring provider pool. So a patient's primary care provider could be somebody that's not even in your practice, but they're assigned to somebody in your practice. Again, most of the time, these are the same. Most often, when the patients are being registered, the care coordination, the front desk doesn't know. Again, another field that I would take a look at to see if you want that required, or can I move through my registration process without filling in that information. Consent. Again, I have mine defaulted to yes, but if I'm talking to somebody on the phone, you want to think about if this consent should be yes for both the medical consent and the RX consent. Again, you can flip those to no. If you have the consent defaulted to yes, it will automatically put in today's date as being signed. Patient class. Often people use this to separate whether this is a Medicare patient, a Medicaid patient, a self-pay patient. Classes are often used for reporting purposes. So if I want to go out and I want to find all my patients that just have Medicare, I can actually just run that report to find a class of patients that have Medicare. I can also generate a practice analytics report just from different classes. Again, classes is usually used for reporting purposes. You'll see that my patient number and my chart number are grayed out. They're grayed out because I have that set up in practice configuration to automatically assign the next account number when I'm registering a patient. Again, it's saying that I'm using an existing account. That account is one. At that point, they still say, okay, is Alice the guarantor of this account? Yes. I'm going to go ahead and I'm going to keep it. So if it wasn't, maybe I could pick the father on the account as being the guarantor. What's the relationship to the guarantor? The account status is active. It's not an industrial account. But then we come up to our slide information. Now the slide information is critical, especially if this patient doesn't have insurance, or maybe the patient has insurance, but you want a slide to take effect after that insurance is paid, or determine if that patient does not have insurance, what kind of slide would they be put on? Of course, your patients bring in information in order to be put on a slide. So you would take that information, and if the patient is going to be on a slide, it is documented. Or maybe you put a patient on a slide and it's pending. So we're going to give that patient, we're going to put that patient on a slide, but it's going to be in a pending status because they couldn't bring in all of the information that we needed in order to put them on a slide. So if you notice on my slide, if I put it on yes, that expiration is set for a year. If I put it on pending, my expiration is a month. So these are also things that you set up in the background that will allow you to set different time frames depending on what documented status you're actually using. Some patients flat out refuse to give you that information so that you can mark that as a refused status. On our income period, we have weekly, biweekly, monthly, quarterly, annual. So I'm going to say that this patient makes $15,000. I want that person's job. and let's say monthly, they're only making $900. But they're supporting 6 people. Now, as you see, depending on what slides I have down here, depending on the information that I'm putting up here, it's determining the discount that I'm going to get. The special population. This often gets missed. And this is a very large part of your UDS reporting. Now, what I always tell people, when you go to update your slides, make sure you're updating this information. As we all know, in this day and age, you could have a job, you can have a house, and next week you could be homeless. So this information is critical to be capturing not only once when this patient registered, but making sure that when you update the patient's information, if you give the patient an information sheet when they come in to update, make sure that the special population information is on the bottom. I could not be a veteran as a teenager, but I may go into the service, so they would be a veteran. A person may not be disabled today, but next month some unfortunate thing happened and they are disabled. So this is, again, not just information that you're obtaining during registration, but absolutely should be updating when you're updating those patients' demographics. Okay? The effective date will default to today because I'm updating it. But when you go in, and you'll notice if anybody has touched it, it's got a very, very old date, like a date prior to you even going on Intergy. So just keep an eye on that to make sure that those are being updated. So if you notice when I came in here, because I'm using an existing account, it was pulling Alice's information over for the slide. I went ahead and changed it for Lori. So what it's saying here is, do you want me to go ahead and all the other members that are attached to Alice's account and update their slide information? I could say yes, and then it would go ahead and update all of the people that are attached to her account. Let's say I don't want it on all of them. I just want it on these 2. I can go ahead and just update it on those 2. Or I could not update it at all. Again, I'm using an existing account. So it's bringing over that insurance information that is on that account. So I have the anthem, I've got my claim, my eligibility. So if this wasn't the insurance, I could actually come in here and remove it. So Lori doesn't have this insurance. Or maybe Lori's covered under this policy, but then Lori also has another policy. So one, I can remove it and take it completely off of my part, not off of the account, but off of my account, or I can add a new policy. So let's say Lori had that insurance plus they have Medicaid. and it's not a PPO. I can add new. Another thing that is key to your UDS is your start and end date. Now, often my Blue Cross Blue Shield is usually a start date of, let's say, January 1st, and it's good for a year. But your Medicaid could be a special circumstance that that patient is on Medicaid and it's only good for a month. But you always want to look at the card and see if it actually has a start date on it. Okay? The end date actually comes into effect when that patient is no longer on that insurance, and then you put an end date on it and take it off of the coverage list. But a start date is very important when it comes to UDS reporting. Then we have our member policy type. Is it a Medigap? Is it an individual policy? Is it a group policy? I'm going to say for this one, it's just an individual policy. I can actually put a note in here that this is actually their secondary. I can add it. And as you see down here, she still has this plan here as the primary. And then she has the Medicaid as the secondary. So if I edit the policies, again, I can remove it. I can add a new policy. Or I can hit the coverage and say, you know what? Because she has Medicaid, Medicaid is first. And then the balance would go to her secondary insurance, even though I put that with secondary. So then it went ahead and it changed the policy to have the Medicaid first. I'll go ahead and take this secondary off. So a lot you can do if you're using existing accounts to be able to add and have that information available to you when you're actually registering the patient. I'll go ahead and do next. So I have my emergency contact. I can go ahead and use the guarantor that's on this account. I can put somebody else in here, maybe a friend, but I'm going to say go ahead and use the guarantor. If it's a parent or a guardian, I can say use guarantor. If you see here, the emergency contact then clicked that this contact person is a parent or guardian. Something I don't see too often is front desk obtaining pharmacy information. Pharmacy information is great to obtain up front. That way when the provider goes to write a prescription, it's already in the patient's chart. So I have two pharmacies I can use. Quite often somebody may go to CVS for some of their prescriptions, but then the other prescriptions are free at Walmart or $2. So they may also utilize Walmart. So if I just put in CVS, that's my primary, and my secondary would be Walmart. But we don't have Walmart. So I'll say Walgreens. Mother's maiden name. And does the patient have internet access? The PCMH page. This is up during registration if you have it set to pop up during registration. If you are doing PCMH, you want to make sure that after a patient has been quick registered or partially registered, that either when they're completing the registration, when the patient comes in, or they're updating patient information, that PCMH page is accessible for them so that they can obtain if the patient has a primary caregiver. I'm going to say none for this one. If they had a secondary caregiver, and then patient's occupation. I'll say she's an administrative clerk. And then, of course, if it is not in your list, and of course here you can't add a new one, I would simply put it in other. So maybe she does both. And as you see, my next button's gone. So I've gone in all the fields that I needed to finish up by using an existing account. Now I could always go back if I forgot something, or I'll go ahead and I'll register the patient. As soon as I do that using an existing account, it's going to pop up because it knows, okay, I added this Medicaid, I need to scan in the insurance card. So I'll go ahead, I'll scan in my insurance card. And then I'm going to close it. And then I'm going to scan in my photo ID. And I'm going to close it. And now it comes up and tells me that Lori's been registered. Do I want to add another account member? So your call center person may, or your front desk person, may actually get a mom that calls that has a bunch of kids that have never been seen there before. If you're doing family accounts, I can add another person to this account. And so I can continue to add the children to this account with that information already being filled out for me, except for the fields that I actually edited during that registration. Or if I was registering a patient, if I don't use family accounts, and I register every single one of my patients on individual accounts, then this is also still going to give me the option, do you want to register another new patient? Nope, I don't want to do either one of those, so I'm going to go ahead and close my registration. So now we've gone through our quick registration using an existing account, but I don't want to do any of that. I just want to register the patient. Now again, those fields that I showed you in the beginning of this class that you can require or not require information on the registration, you can turn them on and turn them off. Again, be very careful with the UDS measures that we absolutely need in order to report back on your UDS in February. I'm going to go ahead and I'm going to register another patient. You notice nobody with this criteria popped up or matching this Social Security number popped up to say somebody else may match this registration. And maybe your patient doesn't go by their given name. They have a preferred name. So Sally doesn't like to be called Sally, she likes to be called Lucy. And if I tab through these, and our front desk people and our call center people do this every single day, so they know what these options already are. So I don't have to use my mouse. I don't have to use my drop downs because I know what all of them are. Of course, I don't. Let's see now. So you notice when I put my full-time student, it doesn't ask for an employer because it's not a school. And let's say these people are from Maine. And my assigned provider, if I have a referring provider, my primary care, which is going to be the same. I don't know about care coordination. Not sure if they're going to be part of care coordination. The consent is yes. It was signed. What their patient class is, and some people don't use class. So if you don't have anything in class, then one, don't make it a required field because that'll frustrate everybody because there's nothing there and they would never get through the registration. They wouldn't be able to do next or register the patient. The account is active. I don't know why we would register a patient and make it inactive, but it's active. The financial group, the account class, it's a standard account. Again, these are things that are part of the parameters that you can set that will default so that when your front desk or your call center are registering your patients, it's information that is standard to the practice that they don't need to fill out. Patient is a guarantor. I'm going to say no because she's too young. I'm going to do next. And again, my mobile phone is required. All of these phone numbers on mine is required. And then I'll go ahead and do next. Go ahead and fill in the guarantor's information. She lives at the same address. And now she actually does work. And I'll just say that she works for Bell Labs, and I'm not going to put in an employee ID. Patient's relationship to the guarantor. So what is Sally's relationship to Lauren? It's the child. Funny how I often see that relationship to the guarantor, they say that Lauren is the mother, so they actually put mother instead of child. So actually, how is Sally related to this person? I'll go ahead and do next. I have my sliding fee. Again, it's a quick registration. A quick registration, I wouldn't have gotten the sliding fee information. On an existing, it's going to bring over any existing that it may have on that account that I'm adding to. But on a new registration, I'm going to have to fill out the sliding fee information. I'm going to say yes. Now, in the homeless status, maybe they do live in a homeless shelter, or they're transitional. They're not in a place that they're renting or they own. Or maybe they're doubling up with another family. They live on the street. They're not homeless. Unknown or other. Unknown would be used if they will not answer the question as far as being homeless. So I'm going to say on this one that they're not homeless. Are they a seasonal worker? It's either yes, they're a seasonal, or they're migrant workers. I'm going to say no on this one. Do they access public housing? Yes or no? Are they a veteran? No. But maybe Sally is disabled. Go ahead, and I'm going to say next. Then I have the insurance information again. So I'm going to say that she's on Medicaid. It's her policy. Again, some people use this member note, others don't. It's a free text field that you can put information in. Now, the subscriber of this, not the guarantor of the account, but who's the subscriber on this insurance? So is it mom's on Medicaid and all the kids are underneath her Medicaid? Medicaid is usually per person. But it could be that mom has Blue Cross Blue Shield and all of the family is covered. So it would either be the patient, but Sally has her own insurance, not her mom, so it wouldn't go under guarantor. Now, other person or company, a company may be that it's a workman's comp case, which is the insurance underneath the company. I'm going to leave it at Sally. Go ahead and I'll add this. And as you see, it adds it to my plans here on the bottom. It automatically blanks out the top portion for me to add another insurance. So I'll say Blue Cross Blue Shield. I'll say this one is actually a group policy, and this is secondary. But Sally's not the subscriber. It's her mom. So once I add her mom, I'll go ahead. And then it put the relationship. So Sally is the self on this one, and on the Blue Cross Blue Shield, it's set as the child. Now, this is a field, I'm not sure why, gets missed, is set VFC eligible. So if you're doing VFC vaccines for children under the age of 18, and they're eligible or not, you would want to set the VFC eligibility. So this child is, I think, 6, and they have Medicaid. Or if they were VFC and they're part of the federally qualified health center, they're coming to your health center. And then the effective date, I'm going to put today. So now I've captured the insurance and captured that they're VFC eligible. I'll go ahead and I'll do next. Again, I have my emergency contact, which I'm going to use the guarantor. And because this is a parent or guardian, any clinical correspondence will be mailed to the parent or guardian at this address. It would not go to the child. We have our default pharmacy again, my secondary pharmacy, and this patient does not have internet access. If there was a primary care giver, and this is all done, so let's say it was the mother. So I can say the primary caregiver is Lauren. And then she does not work. So again, once I register the patient, I can actually come in and scan the photo ID. Now, for pediatrics, a lot of times what they do is they scan the photo ID of the parent that is going to be bringing that child in. So when they check the patient in and or the provider is seeing them in the back, they can look at that ID to see if it matches with the person that is bringing them in. Do my insurance card. And now I've done my photo ID, I've done my insurance cards. I don't need to add an account member to this registration, nor do I need to create a new patient. So I'm going to go ahead and I'm going to close it. So now when we go in and actually search for our patients, I had one this morning. There's information that is within your search screen. So I can search for just today's patients that are coming in. Now your call center, unless the patient calls up and says I have an appointment today, they can search the patient by today's patients only, or they can search them by the name, social security number, phone number, date of birth. And these radio buttons right here for your search is also something that you can default in practice configuration as to, I want everybody to search for the patient by date of birth. Depending on where you are, there could be a large population of patients with the same last name. So you want to make sure that we're actually getting the patient that we need for either completing the registration, giving them any type of information, giving them an appointment. So you'll also see here, I'm highlighted on this patient, but it tells me that it was deactivated. So I can't even use this patient. If I'm looking for my patient and this patient called a week ago and they didn't finish the registration, let's say they did a quick registration or they registered the patient with just certain amount of fields, but they didn't finish the registration, you're going to get this notice up here on top that says registration incomplete. So if I actually clicked on Carla, it's going to tell me in the chart as well that this patient has not been fully registered in the system. The nice thing is that there's alerts all over. Patient doesn't have an assigned provider. There's no sliding fee information. So by looking at these types of alerts quickly when you're accessing patient information is very important. So I can go right from here. I'm not going to go through this whole registration, but I can click on registration. It will bring me into the registration field so that I can complete Carla's registration so that she can be checked in and be seen by the clinical staff, the physician. Their charges can be dropped. Their prescriptions can be sent. Any procedures that are done can be done. So I'm going to go ahead and close this one for now. But another thing people often do is they type in the last name and then they type in the full first name to be able to get their patient. I don't have to type all that. I can type in SMI, BOB and get the same patient in my field. Now, another thing that you can do when you're actually searching for a patient is I just want to search for Bobby. So if I put the comma in front of the first name, I can search just by first name. So if I want to do a first name, last name, I would put in a couple letters of the last name, comma, a couple letters of the first name, or one letter of the first name. If I only want to do the last name, I just type the last name. If I only want to do the first name, I put the comma and then put the first name. Okay, so we're just going to go back to the Abners. So from the top here, if I go to patient, I can go to select to go find a new patient. I can just hit F2 to go find another new patient. I can go to charge posting from here. I can do a checkout payment from here. Lab order request is usually not done by the front desk. Neither is a new prescription. I can add notes to this patient. So if I click on notes, it's a new, and this is also a security thing. Your front desk staff should have access to certain notes. So if I put this at display at search, when I go to search for the patient, the very next thing that's going to pop up is this note that I've actually just typed in at display at search. Okay. I can also add a note that is just going to be in the patient's chart, so a general note. So now I have one that's going to display and one that's just a general note. Here's the note. If I click on this note, I can go ahead and see both of those notes. Tells me if this patient is part of any care programs and what risk level that patient is. Any of these things that actually have an underline underneath them, I can access additional information. So this one said that the consent was signed. Well, I don't know. I want to know when it was signed and when it's going to expire. Emergency contact information. Carla is the emergency contact, but this emergency contact is no longer valid. So I can view edit on here, and I can edit right from here. I can change information. I could say that maybe Carla is still, but she's a parent and guardian. Maybe Carla moved. We have our assigned provider. Assigned provider, referring provider. If they click on the links, not often that a front desk or a call center would actually access these from here, because if I wanted to change, let's say, the emergency contact altogether, or I wanted to change the assigned provider altogether, I would want to make sure that I come in and I do edit. And when I do edit, again, I have the access to do alerts and notes. I can change any of this information here. I can also make this patient exempt from any reporting. If you often create a ton of test patients, you don't want your test patients in your UDS reports. You don't want your test patients in your meaningful use. Any reports that you are actually running, you want to make sure if you are creating any test patients, you want to set that patient exempt from reporting. So they're not included in any counts that you're running for these reports. Okay? So let's say this patient is no longer part of the practice. All the billing's done. I can deactivate this patient so that people do not schedule appointments for this patient. They don't use this patient. I'm going to go ahead and close this for a second. I can also mark this patient as deceased. So when I mark it as deceased, it's going to tell me that there's other things that may exist in this patient's chart. So currently in this version, it's going to make you go out and take a look at all of the appointments, any recalls, any wait list that this patient is on. You could go ahead and you can print this. Go ahead and go and cancel those wait lists, cancel those appointments, take them off of any recall list, and deactivate the patient. I'm not going to put all these phone numbers in there. So, on the insurance, I can come in here and I can go to the coverage list. Let's say that Brian now has the commercial. So when I add it, it adds it back. Maybe this commercial is first. Where I find people a lot of times moving these around is if a patient has a dental appointment. So I'm not sure if that's something that the front desk needs to do, so that when dental is actually dropping their charges, that the dental for that particular visit is going to be first. Or they leave them the way that they are, and then when billing actually posts the charge, then billing selects the proper insurance, and or dental selects the proper insurance when they're dropping their charge. My emergency contacts, again, at this point, I can edit this page, and I can change my emergency contact. Maybe the parent was the guarantor, but the child is over 18 now. I can take that guarantor off of the account. I can change my default pharmacies and my default pharmacy and my secondary pharmacy. Maybe the patient didn't have internet access, but they do now. The extended information tab, if you are doing PCMH, this extended information tab should be pulling your PCMH page. If it is not, you want to make sure that you look at your practice configuration so that this extended information is always defaulting the PCMH page. You can have multiple extended pages, but that one is key if you're actually doing PCMH. My slide information that I put in. Maybe the slide information has changed. And or when I come in here, there's another thing that I like to do for my front desk staff. When I come into options, I can change my page order in my user toolbar. So on my user toolbar, I don't do any of this stuff. I can click on the RX, I can remove it. I can click on the lab, I can remove it. I don't do it. Checkout payment, well, maybe sometimes I sit at the checkout desk and I take payments. Charge posting, maybe I'm a front desk person that never ever does charge posting. I can click on it and remove it. This is the only one you cannot remove. There's not many here to actually select from. It's a very minimal list as far as the toolbar. But if you notice here, I just have the things that I do. But on the page order, I often change this because I find that if people follow, I call it follow the yellow brick road. If they do that every time that the patient comes in, then they're not assuming anything. So I come in and I can put my privacy up top. I know I have to hit that. I have to hit my sliding fee. I have to scan all those pieces of paper. And I may want to look at their upcoming appointments. And then financial. Maybe they have a balance I have to look at. So when I save this, you'll notice my first one is always personal. You can't move this one. So when the patient comes in, I find that when people kind of scan this real quick, they don't catch it, the consent expired. So by looking at this very quickly, I can look at my summary page. I can note very quick that there's no document information, the patient's in collections. But then I'm going to look at the insurance. You still have Blue Cross, you still have your commercial insurance, is emergency contact still Carla? And if you're doing PCMH, if this information has been filled out. My very next thing is privacy. I'm going to look, do I have a consent? Yep, have a consent. I don't even have to do anything on this page other than to click on it quickly to see if they have the consent. The other thing is the advance directives. So if a patient has an advance directive, maybe you have them sign something or they bring in their advance directive that you scan into the system. I'd go ahead and click on New. What type of advance directive is it? It's a living will. I can type any notes and I can save it. Then that living will be here under their advance directives. And I can look at my sliding fee. Is it effective? Did they bring in updated paperwork that maybe that their sliding fee now has changed? But again, when you're updating the patient information, if you're giving them a sheet to verify their demographics, make sure that the special population information is on the bottom so that you can come in and quickly update this information for your UDS reporting. Then I scan my stuff and I'm moving on to my next patient. So it's nice to be able to put these right in a row because when people have them all over the place, I call that carpal tunnel syndrome. I like everything nice and neat, right in a row, and then I can make sure it's all done and finish out by scanning my information. So when you're in the patient information as well, I can have different reports that I run. I can run a patient report, a subscriber report. Now this is going to run for this particular patient, but what I wanted to show you is letters and labels. So letters and labels I can access right from the patient's chart. So when my patient signs in, one, I can have it on the actions and events for when I maybe arrive the patient, that the patient demographic letter automatically comes up. And I print it for that patient to verify their information without me having HIPAA problems with screaming it over the desk. I'm going to hand it to them. They're going to verify it. If anything's changed, they'll update it. You can come here, and if you're doing practice portal letters, I can generate a practice portal letter right from here, hand it to the patient so that they can go and register for the portal. Portal is a large part of meaningful use and making sure that you're getting these patients signed up for your portal. So there's different types of letters that you can add. To your patient information page. Of course, I picked the patient portal letter that's going to take a little while to run. And here's my patient portal letter. It's got the pin, it's got everything that they need right on the patient portal. I can print it and hand it to the patient. Again, these types of things that you're wanting, so if it's the patient has to update their demographics each time they come in, you can attach those types of things to actions and events. So when your front desk staff is checking that patient in, there's different things that the system can automatically do for you so that that staff doesn't have to do things manually. So eligibility, I can run eligibility right from here. So your eligibility automatically runs at night if it's set up. It can run 2 days prior whatever that time frame, or I can generate my eligibility right from here. I can do a pre-collect from here. My eligibility, I'm run, their Blue Cross Blue Shield is unknown, or there's no response. So I would want to make sure that my front desk is actually looking at those eligibilities, or my eligibility department, whoever that is. When we use the existing account when we registered a patient, here's Lori. So right from this account, I can actually click on Lori and go into Lori's account. So when you have families, family accounts, it's nice because when mom brings 3 of those kids in for an appointment, I can quickly go back and forth between the patient's charts. So I want to go back to the PowerPoint real quick to see. So we went over the quick registration. We went through the patient search. We went through the full registration, the patient information window, editing an existing patient, letters and labels from the patient information window, deactivating a patient, marking a patient as deceased. We also showed how to exempt a patient from reporting. And the last thing that I want to show you today, before I open it up for questions, is the quick registration report. So if I come into my select reports and I type in quick, now maybe somebody runs this, an office manager runs this monthly to see if these patients came in or not. These patients don't come in, I don't want a bunch of quick registered patients, so I can go in and quickly deactivate those patients. Now, if this is a report that you're going to run monthly, I could also right-click on it and add it to my favorites. So I don't have to come in and do quick every time. Add it to my favorites. And then when I come to my favorites, it's automatically going to be here for me. So I'm going to run the quick registration report. I'm just going to view it. So here are all my patients that are quick registered and when they were quick registered. So Carla Smith was quick registered on 12/21/11. Still hasn't come in. I can go in and deactivate that account. Or somebody never finished registering Carla Smith, and then they created another account. So that's where we want to be very careful with how you have your patient search set up so that patients aren't creating duplicate accounts. So I'm going to go ahead and I'm going to unmute everybody and open up the floor for any questions. At the same time, I'm also going to launch the poll for the class, but I'd like to know if anybody has any questions that I can answer for you.
Hi, Laurie. This is Victoria. I have a question.
Yes, Victoria.
I actually have two. You said that that searching by date of birth can be a practice setting, not just individual. Can you tell me where that is?
Yes, I can send a screenshot out.
That would be lovely.
Mm-hmm.
And then
I'll write that down.
The second question that I have, when the automated eligibility runs, when it's putting the provider in the eligibility field, is it running off of the scheduled provider or the provider on the demographic screen?
I just looked at that this morning and now I can't remember. We have been going through a ton of back testing of eligibility.
Mm-hmm.
When it's running automatically, I want to say it's the appointment provider.
Okay.
Let me look into that. Do you want to know the manual or the automatic?
The automatic.
Because what we've been testing as well, Victoria, that we find is getting a better response is not actually doing the provider, because quite often you do group billing. So if you put the practice in there, a lot of times you're going to get a better response. But we're writing up.
Yeah, I don't think I knew about that.
That's because we've just been testing it recently.
Okay.
We didn't get to share that yet. So, and we're writing up documentation all around eligibility and AEB and how it works. So I can see where that documentation is and get that sent out to you.
Yeah, that would be great. Thank you.
Yeah, and I'll find out with, I'll send you a screenshot. I'll send everybody a screenshot as far as the default search.
No.
Thank you.
Thank you, Victoria. Great questions.
Mm-hmm.
Any other questions?
Hi, Lori. It's Lynn.
Hi, Lynn.
Just real quick, if you don't mind, if I can respond a little bit on that eligibility part. I don't know, like in our system, when it runs the eligibility and we scroll down, it will actually tell us the PCP that's assigned to the insurance and not our assigned provider. Does that make sense? Like
in the report itself?
Yeah, like it'll tell you the insurance has assigned as PCP in the report.
Now, when it does that, if it's a PCP outside of your practice, is the patient and or the front desk calling to get that provider changed?
Yes.
Perfect. That's on the, so when you run the manual one, are you putting in the actual provider the patient is seeing that day, or are you putting in their PCP?
So the way our system is set up, because I think we do, we have one provider that we set it up under. So we always put, like, we have Dr. Andel, so we put everything under Dr. Andel, and then it'll show up as you scroll down through the report. It'll tell you who the PCP on the insurance is, regardless of what provider we put in.
Okay.
Yeah.
Perfect. And we'll get that information. Lynn, I'll give you that information next week. The additional information that we've been doing and testing on AEV, both manually, mostly manually, but some of the automatic stuff as well.
Awesome, thank you. And then on the, you know, the PCMH on the extended info page?
Yes.
I want to make that default because it doesn't default. Like when you go to the extended info page, it gives the patient.
Let me see if my demo will actually let me go out to practice config without linking into somebody else's system.
Yeah, I was like, can we do that in practice configuration?
Extended information page. It's right here. Can you see this?
No, I cannot. I'm on your quick poll thing.
Okay, I'll take a screenshot of it, and then I'll send it out to everybody so that you know how to actually do that. It's under, if you go into practice config and you just type in extended, it says extended information page for patient.
Okay, so it is in practice. Okay, sounds good. Yep. And then one last question. You know how we can set the VFC eligible? Is that also available on the EHR side for like the clinical staff to be able to set that?
Repeat that one again, Lynn, I'm sorry.
VFC eligible?
Yes, it is. It's actually the VFC eligible is also on the EHR side on the immunization tab.
Oh, cool. Okay.
So and that's why a lot of people, I find that when I'm working with front desk, they don't see it. It's like something that popped up there and they just don't address it. But the clinical staff absolutely addresses it. But if the front desk catches it, they can mark it that because the kid is under 18 and they are VFC eligible either via federally qualified health center or they have Medicaid. But more commonly, they're not VFC eligible because they're fully insured for some reason. But yes, clinical absolutely can do it.
And when they turn 18, do you have to change that? Or does it automatically shut off at 18?
After 18, the immunization module will flip to the adult, which adult does not have
they don't have
that option. Right.
Awesome. Thank you, Lori.
Thank you. Great questions. Yes. Is Alberta still on the phone? Alberta? Okay. I don't know if Alberta's still on the phone. She had asked if I could show how to exempt a patient from reporting. Did everybody get to see that? Oh, Alberta is still on.
Yeah, I'm here.
Oh, I just saw you on. Here, I'll show you. Can you still?
Okay.
Okay, so if I'm in the patient information screen, and I go to personal and I do edit.
Okay.
It's up here at the top. Actions, exempt patient from reporting. That's key for your test patients.
Okay.
Did that help?
Yes.
Perfect.
Thank you.
You're welcome. Any other questions?
Yes, this is Kathy at West Hawaii Community Health Center Dental. On the sliding fee, you said that the links up the patients that are on the slide when you have more than one family member on the slide?
If you're using family accounts, so if I have Lori as the mother, and then I have Felicia and I have Lynn as the kids on my account, then if I update Lynn's sliding fee, it's going to pop up and say, do you want to update the sliding fees for other people that are on this account? So here, let me go into the sliding fee real quick, Kathy. Hold on. Can you still see my screen?
No.
No? Okay. Kathy, do me a favor. Which location do you work in?
Kealakekua.
Okay. So if you write that question down, I will be there next week so I can show you.
Okay.
Okay?
Thank you.
You're welcome. Any other questions?
No.
Well, I want to thank everybody that's still remaining on the call for attending our session. We do have another session tomorrow, which will be for the Dentrix. So if you haven't registered for that one yet, please go ahead and register. And I thank you again for joining our class today.
Thanks, Lori. Bye-bye.
Thanks, Lori.
Thank you.
See you next week.
Bye, Lori.
Bye-bye.